Welcome to tonight's 5 on 5. The guest is Cindy Mayo, the new CEO of Providence, Medford. Thank you so much for joining us.
Great, it's a pleasure to be here.
Well, welcome to Southern Oregon. Tell us a little bit about your background.
Well, I joined Providence in 2002 initially in Washington, and came to Providence Medford this week as the chief executive of the service area for Providence. And my background initially was clinically in nursing and took an administrative track. And I'm very happy to be here at Providence Medford and look forward to the things we'll do together in this community. You
mentioned nursing there as a start, so you were hands-on in healthcare and helping out patients, and now kind of moved your way up. Has that given you a real perspective on things?
I think so. I think that personal connection with patients and families is very meaningful, and I think it helps me appreciate better as an administrator what our patients and families go through every day.
Oh, and you were also instrumental in getting Epic online at Providence in another area.
Correct.
Tell us a little about this computer program, how it's changing things.
Oh, so Epic is a way that we start doing business now within Providence. Went live in May in Medford, and this is a system where the whole patient history and documentation is online, and it allows the clinical staff and physicians to see at a fingertip patient's history, medication history, and not just in the hospital, but in the physician practices as well. So Providence physicians have hospital information and clinic information at the same time. So the safety of that, patient safety is really paramount in that process, and I think it is really the best practice as far as patient documentation and information.
All right, we'll have a few more questions for you, so stick around. More 5 on 5 right after the break. Welcome back to the 5 on 5. The guest is Cindy Mayo, the new CEO of Providence Medford. We've been talking a little about Epic, the new computer program that really synchronizes a lot of information for patients. And how is that helping, too, with all the confusions in healthcare these days, to streamline something else for safety and for many other reasons?
I think probably the safety issue is that the patient medical record is always accurate and up to date. You're not waiting to transfer papers or photocopies. The other wonderful thing about Epic is that as a patient, you can actually look at your own medical record. So if you go to see a doctor today and you want your lab results back, or you have a question for your physician, you can sign up for what's called My Chart in Epic and actually communicate directly with your provider or look at your patient history and medical record, your lab, your pharmacy, those kinds of things. So it really is much safer and much more seamless for the patient experience before the hospital, in the hospital, and in the doctor's office as well. Wow,
so it really does can answer some questions, or if someone forgets something, they can go right back to it and check on their chart. And we were mentioning some of the changes in healthcare. What do you foresee? There's a lot of confusion right now as someone who's running this hospital. What do you see in the changes, and what might have to change going forward for hospitals?
I think what the real focus of Providence, specifically in this community, is how do we help keep our communities healthier? Because the real goal is to reduce the cost for healthcare, but also make sure our community stays healthier. So Providence is very active in looking at outreach programs and education programs about heart disease, about diabetes, about pediatric and infant and child care, outreach with things like mammography. So a lot of prevention services and a lot of healthy teaching kinds of programs. And so Providence really believes that that's our role in the community, is caring for them in a safe way, make sure that the community is safe and that the quality of care they get in the community and in the hospital is very good.
And speaking of the community, how are you able to outreach to some of your new neighbors, your new friends in this new community to kind of understand and get to know it a little bit better?
You know, I think getting involved in community events and community organizations is real important. Clearly, my colleagues will help with some of that, but I am a community-based person, and I really believe that my role as part of the organization is to connect with others, and I'm looking forward to doing that.
If there's someone out there who wants a little more information about Providence or wants to get to know a little bit more about you, where can they turn to?
Well, I would say that specifically one of the numbers they could reach about our education programs, whether it be about heart disease or orthopedic types of cases, that phone number is 541-732-6237. And so a whole host of seminars from Ashland, Grants Pass, education, I would recommend that number would be a great resource for them.
All right, Cindy, thank you so much for stopping by. We appreciate it.
Yeah, thank you.
That's it for the 5 on 5. More news right after the break.